Having health insurance is no guarantee that you will get health care, not if you live in rural America. New report says hundreds of rural hospitals are in danger of closing because they can no longer afford to stay open.
The main reason: insurance pays rural hospitals less than their big city counterparts for the same services. Here's Janet Shamlian.
We were there as workers covered the emergency room signs at Midcoast Medical Center in Trinity, Texas. The sight of medical workers leaving for the last time, signaling this is one of the latest rural hospitals to shut its doors.
I think how sad it is.
Marjorie Polvino runs the hospital board.
It has a huge impact on the committee. We will lose lives. 400 people a month come here.
In the East Texas piney woods, Midcoast was more than a building. It was a lifeline where babies were born and where the heart of Kathy Courtney's 90-year-old husband was restarted, saving his life.
How many times have you used this facility recently?
I'd say about 6 times in the last 14 months.
The closure, hospital officials tell us, was driven by the same factors that have closed other rural hospitals. Low reimbursement rates from elderly patients' Medicare and Medicaid coverage, which made up most of the hospital's budget. Hospitals in urban areas get significantly more reimbursement from their patients who have private insurance, which tends to pay more. Republican proposed cuts to Medicaid could leave more than 8.5 million people uninsured and force even more rural hospitals to close. A new report finds almost 750 rural hospitals are at risk of closing. Courtney's husband is now home and doing well, but the 87-year-old isn't sure she could drive that far if she or her husband of 65 years had another emergency.
When your husband had a heart attack recently, how long did it take you all to get here?
Probably 10 minutes, 15.
And if you had to go to the next closest hospital, how long would that have taken?
Over a half an hour.
Is that the difference between perhaps life and death?
I would say it is.
So, Janet, when these rural hospitals close and folks end up having to drive a long way, what's the overall impact on their health as a result?
They often give up on preventative care, things like regular checkups, and that can lead to the delayed, diagnosis of something like a serious illness like cancer.
What about the effect of these hospitals closing on the community, Janet?
It is beyond the hospital. These hospital workers shopped in the stores, they ate in the restaurants. If they move to a new area for a new job, that affects the real estate market, the school district, property taxes. These rural hospitals are more than health care. They really are the heartbeat of the community.